Intensive care doctors at Intermountain Medical Center say restricting visitation to the ICU is wrong and actually detrimental to patient healing. Fox 13's Zack Whitney spoke to them about a study of why family members should be allowed at a patient's bedside.
I look forward to the day when it's widely recognized as immoral to routinely exclude the loved ones of patients.
Intensive care doctor Samuel Brown says he's on a mission to open up the doors of hospital intensive care units.
Our philosophy is let them in. Bring the partners that a patient wants to be present into the room, into the conversations.
Brown is part of a group of physicians who studied the effects of open visitation on patient care. He says the results showed significantly improved family, patient, and staff satisfaction, with no increased risk of infection or disease.
The stuff you bring from home, with the exception of like the flu, is actually much milder and gentler than any of the infections that would tend to circulate among patients who are sick in the hospital.
Dr. Brown says those antiquated policies have gone on for far too long, and they started just because doctors said so without a whole lot of medical backing. Says there's actually medical backing to show that families being involved helps the patient more.
There's a fascinating study that was published a few years ago in Italy that showed after a heart attack, if you have open visitation, no restrictions, the person with a heart attack has fewer dangerous heart rhythms afterwards. They're less stressed out.
The study was published in the American Journal of Critical Care. Already a handful of hospitals, including Intermountain Medical Center, are adopting open visitation, with a few exceptions. Brown says he hopes it's the catalyst for change. Reporting from Murray, Zack Whitney, Fox 13 News, Utah.